Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dave Craig. He's a two-time cancer survivor, co-founder, and CEO of GRYT Health. Now, GRYT Health is a digital oncology company that empowers people to be in charge of their own health through education, engagement, and support. He's joining us here to talk about the partnership with Bristol Myers Squibb to host the third annual Global Virtual Cancer Conference that's coming up this coming November 11th through the 13th. Welcome to Health Professional Radio, Dave Craig. Thank you so much for taking the time.
Thank you, Neil. I'm honored to be with you and with your listeners.
Well, give us a little bit of insight into who Dave Craig is. Tell us a bit about yourself and talk about co-founding GRYT Health.
Yeah, so it's as much personal as it is professional. In my 20s, I went through 2 different cancer diagnoses. And I was working as a researcher in the pharmaceutical industry and just didn't feel like the experience that I was going through as a cancer patient was really represented in the work that we were doing and the research that I was leading. And so I started GRYT Health to bring those 2 experiences together, to really connect with humans and try to understand the experience in a way that I just didn't see happening before.
And how exactly have you been doing that?
Oh, well, first and foremost, it is always about supporting individuals first. My team and I are cancer survivors and caregivers ourselves. And so we host and create community spaces for people to come together around all types of issues that we're facing, whether they're physical or the mental health and connection needs that affect us so much. By bringing people together first, we're able to support individuals going through the experience. And then, because we work with organizations, learn what they're trying to improve and bring those 2 things together.
Do your efforts only benefit cancer patients, survivors such as yourself and your team, or the people who support you as well, the caregivers? Does it delve into their experiences and take that into consideration in your research as well?
Yeah, I love that you asked that question. We view the caregivers as equal partners in this. I myself am a caregiver now to my girlfriend who's going through a stage 4 cancer diagnosis. And I have to be honest about how different and intense it is to be someone, watching and supporting and trying to help. And so, to have the experience as a patient and now as a caregiver with someone I love with all my heart, we understand that intensity for caregivers and work just as hard to support and include them as well.
Why is it so important for healthcare professionals themselves to get a better understanding of the experiences of their patients and the caregivers who are taking care of them when they're not around?
Yeah, that is the most important question to us, Neil. And, throughout the history of healthcare, organizations relied on medical records and physicians' input to try to understand how patients are doing. But patients never had a direct voice in the system themselves. And in 2015 and 2016, the FDA changed that. They created patient experience guidelines, which say that we actually now have to interact and learn from patients themselves to see how they're doing, because so many of these experiences don't fit in the way medical records capture experiences. And also, if you haven't gone through it before, it's just so hard to relate. So because our team has gone through it and can understand, we care about digging deeper into the ways that humans are affected and trying to create change around that just as much as the biology of beating a disease.
Do you think that maybe there's been kind of a wall placed on the part of some healthcare providers, because it is a very intense treatment to go through someone's life as they're dealing with any type of cancer diagnosis? Do you think maybe some of the blockage has been kind of a defense mechanism for some of our healthcare providers that through some of your efforts is now being kind of broken down to gain more understanding?
Yeah, and to be honest, doing this work now, GRYT Health is almost 6 years old, and I've been doing this now for almost 10 years. Having time to connect with physicians and healthcare providers and nurses to really hear from them and learn too. This is about coming together and empathizing with each other. I can't imagine what it's like to work in those positions knowing how tough it is to try to treat and care for dozens or hundreds of individuals, and so by doing this work, we really try to bring people together to understand from more perspectives, not say, you have to do something differently there or you have to do something differently over there, but how can we really come together and make change, collectively?
Now, I understand that you've got a big event coming up. I mentioned it earlier through a partnership with Bristol Myers Squibb. Talk about this event and explain how it's going to transform the way that pharma listens to patients.
Yeah, this event is all of our heart and heads in what we do. It is called the Global Virtual Cancer Conference. Anybody can visit us at globalvirtualcancerconference.com. And Bristol Myers Squibb really helped create and found this with us so that, patients and caregivers who can't travel to all these physical events that people go to gain support and resources and all this, we're able to meet them where they are, whether that's on their laptop or their phone or a mobile device, bringing the experience to people instead of forcing people to go somewhere is at the heart of this whole thing.
As far as transforming the way that pharma is going to begin to listen to patients in a way that they've never listened before, especially on the tail end of the opioid epidemic. I'm hoping the tail end of it.
Yeah. And, when you think about what happens when people come together, and specifically the voices that don't often get heard, right? So, health equity and disparities that have really been highlighted through the COVID pandemic, through the opioid epidemic. All these things are just showing the disparities in our system. And by bringing people together that don't often have other ways to share their voice, we get to learn and hear things that oftentimes, quite frankly, are just shocking. The more I interact with diverse individuals and hear their experiences, the more it hurts and the harder I want to work to create change. So to answer the question, bringing people together allows us to hear those voices that oftentimes don't get heard.
And I'm sure that some of the cultural differences between all the many patients who are dealing with the same disease, I'm sure that's taken into consideration as well.
It is. And, one of my mentors and cultural advocate, Sheila Thorne, says that, oftentimes we have more differences within our groups than across them. And it's true, cultural differences and these experiences can really be unique. But when we come together, we realize how much the human experience binds us, and we can find support in that. So absolutely, we learn things, across groups and the differences. And we also learn just how much we have in common and how much we're trying to improve our health and others.
Where can we point folks online to get more information about this event and to register if they're so inclined?
Yeah, we would love anybody to visit us at globalvirtualcancerconference.com. You can Google it and check out more of the information and register there.
And I do believe another source for GRYT Health would be helpful as well.
Yeah, thank you. We would love you to meet our team and see who we are and all the work we do. And you can find all of that at grythealth.com. We spell GRYT with a Y. So it's GRYT Health.com. And we hope to see you there.
Dave, it's been a pleasure speaking with you this morning. Thank you so much. Congratulations on your third annual event. And hopefully we'll get an opportunity to speak again.
Thank you, Neil, and thank you so much for including the human and the humanity in the work that you do, too. It's an honor to be a part of it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dave Craig. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.